Welcome back. Dr. Anna Marie Temple is with us answering all kinds of questions about eczema and other skin issues. This person is asking, I have psoriasis. What exactly is the difference between eczema and psoriasis?
So the difference between eczema and psoriasis, that psoriasis is much more of an autoimmune condition where the body is attacking itself, and it shows up in a different plaque-like, has red lesions, thick plaques, and it can also invade the joints, where eczema does not invade the joints or touch the joints in any way.
And does eczema have anything to do with your immune system?
Absolutely, but it's not as it's not as autoimmune, if you will. So in psoriasis, we have a much more robust attack of the skin with the antibodies, but in eczema, we still have an antibody issue as well. So they're both immune inflammation.
Okay. All right. This next question is eczema inherited? I have psoriasis that I get rid of with medication. Meds don't really work for me. Never scratch, but my sons now have eczema.
Oh, all these questions are so good. So there is a genetic component. If one parent has eczema, it puts the child at risk of 40% getting eczema. If two parents have eczema, it puts the child at about 60% chance of getting eczema. But the genes only make our bodies more sensitive. What we talk about in holistic medicine is the genes load the gun and the environment pulls the trigger. There's a whole bunch of people that walk around with psoriasis genes and eczema genes and never actually develop this illness. And then we have other people that are always developing it. So we do have the genetics, which means we need to be even more cautious with our nutrition. We have to be even more attentive to our micronutrients, to our gut microbiome, to our stress levels. And is it fair? No, it's not. But what I usually tell people, I'm like, when you have this genetic background, you're much more of a sensitive human. So we have to be much more careful with our lifestyle and the choices we make every day.
All right. This next question says, my 1-year-old has eczema on her hands, and I have prescriptions, but it's hard because she puts her hands in her mouth like every kid does. What is the best way to treat the hands with small children?
Again, we're looking at eczema as a topical issue and what we're going to put on our hands. And we do need some topical things in order to rebalance the microbiome of our children's skin. But I'll tell you, we still have to work with processed foods. Are you nursing? Or is she bottle fed? Or does she have a lot of dairy in her diet? What about the amount of sugars? Have we tested her vitamin D levels, zinc levels? Is she pooping every single day? All the things that we just talked about still apply even when it's just on the hands, because it seems it's just on the hands, but the inflammation is deep inside and we're only seeing the tip of the iceberg.
So they need to go to their pediatrician and really have discussions about what's going on with this.
Correct, and dig deeper, and let's look at our diet and lifestyle and see what we can add. One simple thing that you can add that is safe for kids, you can actually do a bentonite clay that you can put in your bath. You can use half of a cup of bentonite clay in a bathtub, and the kids can play. It detoxifies the body and the skin and can help moisturize and soothe those achy skin parts.
All right, this person says, my granddaughter has eczema. They used all kinds of prescribed ointments and soaps. She's in Dupixia injections, but she still scratches. Do you have any suggestions?
Yes, so when we're doing the prescription medications are usually topical steroids, topical antibiotics. Dupixent is an immunomodulator, so it's an immunosuppressant. I know it's called a biologic, it's an immunosuppressant. And the whole point is to decrease the immune system from attacking the skin. However, modern medicine is great. I'm not here to badmouth modern medicine, but modern medicine is for acute care. It's for acute symptoms, but it is not getting to the root cause. When you stomp down the immune system, we're not asking the question, why is the immune system out of control? Why is my child having all these sensitivities? Why is my children's body inflamed? We need to ask those questions and get to the root cause. We could use topical steroids or Eucrisa or Dupixent or other medications, but those are only temporary until we get to the root cause. And that's how we get long-term healing.
Gotcha. Okay, got to get to that root cause. Thank you so much for your time and your expertise. We appreciate it. If you missed any of this, you head to our website, click in the Who Wants to Know section.